be rolled out immediately. We are also going to mobilize the National Youth Service and the Engineering Department at KDF. And we have also agreed with the Ministry of Roads that all the road contractors in the different parts of Kenya will now be mobilized to provide emergency intervention services to make sure that roads are opened in different parts of Kenya. And we are going to mobilize the resources necessary to make sure that contractors on the ground in different parts of Kenya are mobilized for emergency intervention activities. Additionally, the Ministry of Health, working with the Council of Governors and Red Cross, will be mobilized to provide medicine commodities for water treatment, for disease management, be it cholera, malaria, and all the others that will be assessed as requirements in different parts of Kenya. The Minister for Health, who is here, has been tasked to provide leadership with the different agencies working in collaboration with the Council of Governors to make sure that health commodities are available in different parts of the country. The lead agency in making sure that all the roads, especially the trunk roads around Kenya, KENHA will provide leadership, and the Ministry of Transport and Roads will make sure that sufficient resources, human, machine, and money is available to make sure that that process is undertaken. The Ministry of Water will also work with the Council of Governors to make sure that where water infrastructure has been submerged, to ensure that there is water for drinking and for use, so that we avoid the now emerging cases of cholera in some parts, and malaria in other parts, and diarrhea in other parts of Kenya. We want to make sure that this situation is managed, and as a result, the emergency situation has necessitated Cabinet to meet on Monday as a first thing, so that we can receive the reports from this multi-agency team, process those reports, and provide intervention mechanisms to make sure that we manage this situation. The Ministry of Energy has been asked to liaise with the counties to make sure that as our dams fill up, citizens are informed across, especially in the areas that we could have overflow of dams, so that citizens are relocated early. We're informed that within the next 1 week, some of our dams will be full, and therefore there will be need for information to be made available to citizens, so that if there will be need to relocate some citizens from the downstream, that should happen ahead of time. The provincial administration has been tasked to make sure that citizens who are living in areas where there could be possibilities of mudslides are informed ahead of time, relocated ahead of time, so that we avoid unnecessary losses, as we have seen in the past, of citizens who have become victims of mudslides in Kenya. The information that we have is that rain is going to continue. Kenya is already soaked, and water will be now flowing when it rains, and therefore we run a higher risk of flooding in different parts of Kenya.